Ayurveda is the science of life. It is the traditional Indian system of medicine. It dates back to about 8,000 years, or 8,000 BCE. It's one of the most widely practiced healthcare professions in the world, and is regulated by the Indian government. So because Ayurveda is an ancient system, it didn't have a lot of the technologies that we have today to examine the patient. So through clinical trials and through the extension of logic, the physicians of India developed threefold methods, a threefold method of examination using observation, touch, palpation, and questioning. And also an eightfold method. So the threefold method is how we approach the eightfold method. The eightfold method is the specific area of the bodies that we examine, including the form of the person, the nails, the eyes, the ears, the urine, the feces or stools, the pulse, and the tongue. So each method reveals certain characteristics and physiological functions, as well as reveals pathological changes that are occurring in the body. And each method is not complete on its own. So each mark or stain or discoloration on any of those, on the face, on the nails, on the eyes, on the ears, tells a story, but it's only one story, one clue of what's happening with the individual. And by taking all those methods, the eightfold method and the threefold method together, then we get a kind of a window into what's happening with the individual. So the purpose of this presentation is to give you a little window into self-exploration and your own personal empowerment. And what we are discussing today are only possible indications of things that may be happening or that you may be experiencing in your body. So it's not a complete and accurate diagnosis, but just a fun little exercise to get to know yourselves better. So like other systems of indigenous medicine, Ayurveda uses the 5 elements: space, air, fire, water, and earth. And a lot of people say, well, it's not really relevant today, but if we look at our bodies, we can see the space element as being any space within the body. So the space in the cranial cavity, the abdominal cavity, the space between the bones, the space in between thoughts, the space in between cells. Air is expressive of all nervous impulses. Fire is found within all the enzymatic systems of the body, the digestive system. Water is within all fluids, the synovial fluid of the joints, the cerebrospinal fluid, all mucus secretions. And earth is found within all structures of the body. So we see that there are 5 elements within the body. So the structure of the body is made up of the 5 elements, but the function of the body is dependent on the 3 doshas. And this is what sets it apart from all other systems of indigenous medicine. So doshas are things that uphold the vital function of the body when they're in a healthy functioning state, but when they're out of balance, they create all pathological disorders. So each dosha is a combination of the 5 elements. So vata, so the 3 doshas are vata, pitta, kapha. Vata is a combination of space and air elements, and it's responsible for all movement. So it has an affinity for the bones and for the nervous system. Pitta is the combination of the fire and water elements, and it causes transformation, and it's responsible for all digestion, absorption, and assimilation, and it has an affinity for the blood. And kapha is the building or the cementing force of the body, the protective force, so it's responsible for upholding all immune function and protecting organs as well. So in contemporary medicine, or in allopathic medicine, we can equate the 3 doshas with the 3 phases of metabolism. So vata is equated with the catabolic phase, where structures within the body are broken down into smaller and smaller parts. Pitta is equated with the metabolic phase, which transforms one substance into another, in particular the outer nutrients into living tissue and into consciousness. And earth is, or kapha, is the anabolic force of the body, is the building, cementing, protective force of the body, and again, it upholds all immune function of the body. So the tongue, if we look at the tongue, we notice that all the organs of the body are mirrored on the tongue. So at the tip we have the lungs, and in between, and along the center line, is the heart. Below the heart, continue along the center are all the organs of the GI tract. So we have the stomach, the pancreas, the large intestine, and the small intestine, and the colon in the back. Below the lungs on the sides are the liver and the spleen on the left, the liver on the right, and the kidneys behind those. So when we first look at a tongue, the first things we want to take note of are the size and the shape of the tongue. And this gives us kind of a clue into what elements are predominant in that person's constitution. So if we see a really broad tongue, a big tongue, a very thick tongue, then we can say kapha is a predominant element or a predominant dosha in a person's constitution, and they're prone to kapha disorders like lymphatic system disorders, because kapha has an affinity for the lymphatic system. If we see a very sharp or angular tongue, then we can say pitta is predominant in the constitution. And if we see a thin, wiry tongue, then we can say vata is predominant in the constitution. Okay. So if the tongue is shaking a little bit, like if I was to stick out my tongue right now, it'd be a little tremoring. So this is an acute vata disorder, and it's fear, anxiety, and nervousness. So this is an acute vata disorder. But if this vata becomes more ingrained in the body and starts to create catabolic changes within the body, then we'll start to see a geographic tongue. A straight line down the center line of the tongue indicates that we're holding emotions or tensions along the spine. So it can indicate stress, can indicate back problems, especially if there's a zigzag line or a crooked line, which indicates scoliosis. If the zigzag is at the back of the tongue, then it indicates that there's lordosis, and there's possibly lower back pain. And if it's the tip, then it's kyphosis, and there's possibly upper back pain. If there's two lines, vertical lines, either side of the midline, then it indicates that we may be holding tension in our shoulders or stress in our shoulders. So discolorations over organs on the tongue indicate that there's delicate or weak organs, or there's some form of organ dysfunction. We don't know what that is yet, because this is, again, just one indication. So it's just a kind of a marker that there may be some dysfunction within those organs. So we see here there's a dysfunction or a discoloration over the heart area, so there's dysfunction in the heart, or possible dysfunction in the heart. Okay. And likewise over the kidneys and the colon. So when there's discolorations over the lungs, if it's a very light discoloration, then it indicates that there's low lung energy. But if this discoloration becomes a froth, then there starts to become functional changes within the tissue. And we can call this, in Ayurveda, we call this avalumbika, it's a big mouthful, avalumbika kapha dushti, which means functional disturbance of kapha dosha in the lungs, which we would equate with bronchitis in Western medicine. If that discoloration in the tongue turns darker and becomes more prominent, there starts to be structural changes within the lungs, and it mortifies into pneumonia. So there's a clear line of differentiation in Ayurveda between imbalance and disease. And the main cause of this is, you can switch the slides, is ama formation. And ama formation are basically toxins or unprocessed or undigested metabolites, which have a propensity to lodge in tissues, and they create micro-inflammatory changes within the tissues. So when there's micro-inflammatory changes in the tissues or toxins within the tissues, then functional changes become structural changes. So the factors that cause ama are undigested food, stagnation of waste products, including urine, stools, sweat, so constipation, disturbed doshas, bacteria, viruses, parasites, food poisoning, improper food combination, and repressed emotions. And some of the signs and symptoms of ama include clogging of the channels, fatigue, subjective feeling of heaviness, Antiperistaltic movements, acid reflux, constipation, malaise, lethargy. So the way I look at malaise and lethargy is the feeling that things aren't right. When you feel like that you have low energy, that you just can't get motivated, that this is a sign of toxins that are in your body without even having to look at your tongue. Indigestion, sticky gummy secretions, sticky sweat, retention of waste products, weird or strange, unusual taste in your mouth, and depression. So ama shows up as a coating on your tongue. There's 3 different types. There's a white coating, which indicates that there's a slow digestive function, and it's called the cuphogenic ama. And there's a yellow-green coating, which indicates that there's a pitogenic ama. A cuphogenic ama creates sensitivities to gluten, and it also causes sensitivities to carbohydrates. So people with cuphogenic ama have a hard time digesting those types of foods. People with pitta ama, which is a yellow-green ama, have a hard time digesting fatty fried foods, and they're subject to acid reflux. Vatogenic ama turns out as a brown or black coating at the back of the tongue, and these individuals have a variable appetite or variable digestive function. They have a lot of unprocessed waste or unprocessed foods within their stools, and they're sensitive to protein, high protein foods. They have a hard time digesting. So during the normal process of digestion, what happens is when we eat food, it dampens the digestive fire, dampens Agni, and kind of slows things down just naturally, so we kind of sometimes feel a little bit tired or sluggish after food. And if you look at your tongue, you'll notice you'll have a white coating. Through the 6 hours that it takes to digest food, slowly that coating will move to the back of your tongue and eventually disappear. If it doesn't disappear, then ama can circulate through your body and create pathological changes within your body. So a simple way to take care of ama is just to take 1 slice of fresh ginger, 1 squeeze of fresh lime juice, and 1 pinch of rock salt 15 minutes before and after lunch and dinner. Sorry, I just have to get a drink. So, if there's no coating on the tongue, there may still be ama in the deep tissues of the body. If you see these malabsorption lines on the sides of the tongue, and they look like teeth marks, it looks like the marks that your teeth would make on your tongue, but they're actually caused by malabsorption, and there's ama in the deep tissues. So here we see a healthy kapha tongue. There's very little coating. It's nice, round, and plump. And the most notable thing is the color. It's a nice rose petal pink color. And here we see a tongue with a heavier, thicker ama coating towards the back. There's low thyroid function. If you notice, there's a straight line down the spine. Oh, very good. So there's a straight line down the spine. And if you notice actually towards the back, it actually goes crooked, so this individual might have some lordosis or some lower back pain. As well, he also has some low thyroid function. There's a sunken tip, and there's a bit of inflammation, which can be caused by that ama. So there might be some microinflammatory changes taking place within his tissues. So here we see a classic geographic tongue. So this indicates that there's vata and degenerative changes taking place within the body, whether it's in the bones or nervous system, we don't know, but it's an indication that there are catabolic changes that are occurring in this body. So again, this is a kapha tongue. This is a young person, and the most notable thing here is the teeth marks along the side, the malabsorption lines, and there's a slight coating of ama on the tongue. And if you notice the rim is really pink, it's red, so there's heat in blood, there's some toxins that are creating some micro-inflammatory changes. And also that his tongue is swollen, there's glossitis. So this, which is folic acid deficiency anemia, so his malabsorption can be causing this folic acid deficiency anemia. So this is called shade patches on the tongue, and it indicates giardiasis or parasites. This individual has low thyroid function, slight malabsorption, and he might be suffering from a little bit of mid-back pain, so maybe around his shoulder blades or down below is slightly curved. This is the most interesting tongue that I can find. Dahlia refuses to look at this picture. I'm like, wow, that's great. I've never actually seen a tongue like this before, except for in this picture, so I had to include it. So in this tongue, the most notable thing is this deep. Do you want to use the pointer? This deep impression. Just yes, use the force. So it's this deep impression over the thyroid area. And it's interesting because he has this really thick coating of ama on the tongue. Oh yeah, you can see it in the big one too. So he has this really thick, so there's manda agni, there's very slow digestive fire, and there's probably more than likely fatty degenerative changes that are taking place because his thyroid function is so low. And there's this heavy buildup of ama, and also this is a very kapha person who's very round and plump, so I would look towards fatty degenerative changes. Okay, so this picture is again a slightly geographic tongue, and again there's tension along the spine, slight scoliosis up toward, or kyphosis up towards the back, so he's holding a lot of tension in the back, and there's some malabsorption as well. So this is classic pathogenic ama, and it was interesting. I was looking at this picture and taking a lot of different things into account. This is an infant. So normally when you would see a pathogenic ama, it usually indicates that there's degenerative changes going on in the bones, but it also indicates that there's irregular digestive fire. So this baby probably is suffering from colic or from irregular, having a hard time to digest its mother's milk. So go back to the other side. That's okay. So if you can grab a partner really quick and just briefly take a look at each other's tongues and see if you can make a note of any lines or marks or anything you've noticed. You have to get over the fear of looking at your tongue. And the best time to look at your tongue is first thing in the morning. And you may also look at your pet's tongues as well. They show the same characteristics, they have the same physiology, and they are akin to the same disorders. So thank you all very, very much for coming this evening.